Turning now to the West, where California's health officials say they are so strained that they're asking temporary medical workers from other countries to come in and help them. And it comes as the state battles its worst increase in COVID cases and hospitalizations so far in the pandemic, with total cases on track to soon surpass 2 million. California would be the first state to cross that milestone, and News Nation correspondent Nancy Liu is live for us in Los Angeles tonight with the latest. Nancy.
And Marnie, that milestone could be reached before Christmas. Today, health officials again implored Californians not to travel, to stay home, not to gather. Here at LAX, clear signs that a lot of people are traveling anyway. And as you've heard, California could soon become the first state to hit 2 million COVID cases. It's only about a quarter of the typical volume of holiday travelers at LAX, but it's more than health officials would like to see. Despite all the warnings, many Californians are masked and on the move.
No, I don't feel guilty because I do the things they're saying to do. I don't just show up without a mask, or, you know, you do the common sense things, and then you just, hopefully you'll be protected, you know.
I'm going to see family that I haven't seen in a couple years, so I'm excited. We don't really travel as much, so it's that time of the year at Christmas, and I like to see my family.
The apparent repeat of Thanksgiving movement comes as California reported nearly 33,000 coronavirus cases today, bringing the state total to well over 1.9 million.
We Californians are the first line of defense. We have choices.
Today, hospital leaders and frontline workers issued a joint call for people to stay apart and at home as much as possible, stressing the current strain throughout the healthcare system.
We've got patients in hallways, patients in various locations, but the big challenge for our organizations is that our staff are tired and we don't have the numbers. They're taking care of more people.
With ICUs at capacity and a daily influx of patients, hospitals such as UC Irvine are easing the strain by adding beds inside a massive field tent in a front parking lot.
Our emergency department, our inpatient units are very, very busy, and we want to be able to decompress some of the stress on those units.
Surge facilities are beginning to open, and the state has been scrambling to bring in thousands of staffing reinforcements, even some from overseas. Meantime, many on the original front line are exhausted, having been there for 9 months.
We continue to look to hire, frankly, throughout the state. Not every hospital is part of a large system. So the ability to shift staff to needs is not as nimble for some of the smaller hospital systems or unaffiliated hospitals.
And due to the ongoing crush, there's word that staff at some LA County hospitals have been instructed to shift strategy to save as many patients as possible during a crisis. And in effect, that means leaving patients less likely to survive to receive less medical care. Live at LAX, Nancy Liu, News Nation.